Well, joining us now is Dr. Gary Davis, who is the Secretary of AASLD. Thank you so much for joining us.
Happy to be here.
You're going to talk about HCV Therapeutics. That's kind of the real headline of this liver meeting.
It is. It's a time for a lot of change in the treatment of hepatitis C. It's a disease that we've had difficult treatment for a number of years, and it's gotten much easier. We're targeting the virus directly, so it's a good time.
And there are a range of treatments either coming out or in the final stages of approval and so forth. How is it that doctors, it must be a challenge for them to integrate all of this into their practice?
Oh, I think so. It's confusing, and as we develop these new treatments, we find different subgroups that we need to treat differently. And because of this, the AASLD and the Infectious Disease Society of America have actually developed a guideline, which will start in January. That will be dynamically updated on the internet so that people will be able to know how to use these new treatments as they come out.
That's good information. There's a range of therapies for patients, and this is really sort of a giant step forward.
Well, it's a big step. Certainly, all these new drugs that have come out over the last 25 years have been big steps. I don't think it's the final step. We have a long ways to go to where we can effectively treat people without side effects and get everybody to clear virus.
And what are the takeaway lessons you're hoping that folks will get from this session?
That it's an exciting field where things are changing rapidly, and there's a lot of hope that we'll be able to eradicate this disease with a short period of treatment and few side effects.
That sounds terrific. Thank you so much for joining us.
My pleasure.